With more on the spread of Ebola and the global efforts to fight the epidemic, we're joined by Walter Tsou. He's a consultant on public health care and healthcare reform, and he also teaches health policy at the University of Pennsylvania. Thank you so much for joining us. You know, the World Bank and IMF meetings being held here in Washington right now, earlier pledging $500 million to the three countries that have been the hardest hit. One, do you think it's enough? And two, is it too late?
Well, I don't think it's enough, frankly. I think we are going to at a point where we need to put a huge amount of efforts, probably at a minimum $1 billion, to help stem this epidemic. We're talking, in some estimates, in the worst case scenario, maybe over 1 million people who have been exposed to Ebola. You're talking about numbers that have actually devastated and closed down those countries in Western Africa. And we need to actually do everything we can, throw all our forces into trying to stop this epidemic in Western Africa.
So we haven't even seen the worst yet, it sounds like you're saying. What do you make of the global response to Ebola so far? Do you think that some countries outside of Africa have been much slower to respond than others?
I do think that we haven't stepped up our game as we should. I think now that we're starting to realize how out of control this epidemic has become, that people are getting worldwide attention around this. It's now clearly in the backyards of some of our European countries and here in America. And I think that's raised the expectations of doing something about it.
You know, the director of the Centers for Disease Control and Prevention here in the United States stated that Ebola could be the world's next AIDS epidemic. Do you agree with that statement?
Well, it's possible that it could be a huge problem. I don't know if on the scale of AIDS, but I would say that it's conceivable. Both are spread through bodily fluids. This one seems to have a much more rapid case fatality rate than those with AIDS. We have some treatments out there, obviously, for AIDS. We have no treatment for Ebola. So the scale and devastation of this current epidemic is sort of mind-boggling.
The United States recently announced the stepped-up screenings at 5 major international airports across the country. Do you think they'll be effective, and do you think other countries will start following suit?
Well, I think it's an important start. They're going to just do screening for evidence of fevers for passengers who are coming in from some of those Western African countries. But as we know, the incubation period can be as long as 21 days. There are people who clearly will escape the fever test, if you will, at the airports and still may come down with symptoms, as we saw in the case of Thomas Duncan in Dallas. So the word here is vigilance on the part of all healthcare professionals, and we need a healthcare system that has, if you will, an open door policy so that people know that if they feel sick and they come from those Western African countries, we will see them without questioning the problems about insurance or other potential barriers.
You mentioned that the world has been slow to respond. Do you think we're all headed in the right direction in terms of coming around to defeat Ebola or to end the epidemic?
I do think that we have the world's attention on this issue, and I do think that that's a good sign in terms of our ability to defeat this. We're starting to bring in the supplies. The real problem, frankly, is that we don't have the vaccine. We don't have an effective therapy right now, and things could get worse before they get better.
All right, Walter Tsou, we appreciate your time. Thank you so much for joining us here on the show.
Thank you, Elaine.